A few weeks ago, we kicked off our 2022 series on rare diseases, asking who the stakeholders are that need to be involved when we want to have the greatest impact on rare diseases. Today, we're drilling down to better understand one of these stakeholders, innovation hubs, also sometimes known as centers of excellence or expertise.
In rare disease, a center of excellence is based around clinical capacity. In other words, Anna's program in Vancouver has deep capacity to do a lot of things for patients. So you would expect, the ability to care for kids, adults, having all the secondary specialties, all the things you would need to care for a patient. An innovation center doesn't necessarily have the clinical chops, but actually is a place where they are focused on the research, developing new products, new strategies, new treatment protocols for patients. So while the two can overlap, there can actually be quite separate entities.
So what we found in our hospital, we're having great access to next generation sequencing, exome sequencing for diagnosis now, and it's quite equitable in Canada, I have to say, because of our public healthcare system. But the next problem we had were variants of uncertain significance, some of which looked quite compelling. The majority often, you can tell that they're probably not relevant, but some of them really needed more evidence to kick them over to a diagnosis for the patient. So we created what we call a discovery hub to connect our patients with the expert in that gene around the world and have a platform or infrastructure whereby we could provide consent and material transfer agreements, resources for collecting samples, creating cell lines, shipping, tracking in a very coordinated and a safe kind of way. This was a huge improvement to our center because clinicians have great ideas, make these interesting findings for patients, but lack the time and capacity to create new protocols de novo every time and to, ship things off of their desk.
I've seen several families, when when their child has been diagnosed with a rare disease, the first thing we help guide them, connect them with other families through their Facebook pages. Often there's no family support group existing at all. But when a small critical mass forms, they all seem to go through the same steps. The families get together, they launch a foundation, and then they recruit a few scientists or clinicians, and they have a scientific advisory board. But their goal, their sole aim, there are two things. One is understanding of the disease, and the second thing is developing treatments for the disease.
It's a discovery period. So while we're using a lot of this information clinically, I think my colleagues here might actually say a lot of times the most common answer we give a patient is maybe. We think this change we found probably causes this, but now we're doing the background work and sharing these cell lines, sharing this information. One of the things that has really been encouraging about this field is people are sharing their data. When they find a new change and they have a clinical presentation with it, that data is then put out there for other folks to look at saying, we've seen the same thing. So I would say we're at the edges of the puzzle right now. We've got a ton of thesis to fill in the middle moving forward, but these are the types of efforts moving forward that are going to get that done.